Hi there, it's Dr. Kathleen Cannon, and we're back with the vitamin alphabet. Today's vitamin is B5, which is pantothenic acid, and the active form of B5 is coenzyme A, or CoA for short. CoA, B5, is involved in all of your metabolic processes, essentially. It's involved in how your body takes in and handles your fats, your carbs, and your proteins, all of your major macronutrients. And so that's where you get your nutrition from. If you are having issues with B5, your metabolism is going to be impacted. B5 is especially involved in fatty acid oxidation. So in particular with fat metabolism, B5 plays a role, but it plays a role in all of your metabolism. B5 can also be supportive for atherosclerosis, osteoarthritis, skin conditions, and much more. B5, because it's involved in your metabolic processes, it's really essential for your body to function properly. It's essential for your tissues to get enough energy because your metabolism is how your body gets energy. So B5 is essential for how your body gets energy, for how everything in your body is able to do its job and function properly. So when you're deficient in B5, it's going to impact your body's energy, and you can feel tired, you can feel weak, you might have slower growth or slower repair. For example, repair of like a cut or something in your skin. You can have skin issues. B5 deficiency can manifest in many different ways because of how central B5 or CoA is to your metabolism. It's also very difficult to diagnose a B5 deficiency. There are many factors and vitamins, nutrients, many things involved in your metabolism. It's very difficult to narrow down an issue to just B5 because it is involved in so much. And I should mention also, it's uncommon really to see a B5 deficiency that's very severe. How do we determine if you're deficient in B5? We can do functional testing where we look at a urinary organic acid test to give us an idea of your B5 status. And what we're looking for in the B5 testing is not B5 itself, but rather different factors that are also involved in processes where B5 is involved. So if you think of it like there's a pathway that uses B5, and that pathway is going to get stuck at a certain point if there's not enough B5. The pathway is just going to stop. It's like you're driving down the road and you run out of gas. The pathway is going to stop. So when that pathway stops, there's going to be a buildup of other factors that are involved in that pathway. They can't go further because there's no B5. So for example, your car runs out of gas and you get stuck, and then there's a buildup of traffic behind you. So the urinary tests really test to see what the overflow is, what's backed up. And by looking at a pattern of different tests that look at all of these different processes that use B5, we can kind of narrow it down to get an idea that there might be a B5 deficiency happening. That's kind of a really good way, testing-wise, to get an idea of deficiency. Now, again, B5 deficiency is not too common. B5 is available in almost every food that you eat. Because B5 is so central to metabolism, it's in almost every food. B5 is not just central to human metabolism, it's also central to animal metabolism as well as plant metabolism. That's like almost all life forms, right? Well, we are leaving out some microbes, but we'll leave them out for now. So B5 we really can get from almost any food, especially whole food forms of foods. Processed foods are not going to have as much. They're not going to be as nutritive. So whole foods are really where it's at. And with B5, particularly rich foods would be organ meats and lentils. And B5 is a water-soluble vitamin, as are most of the B vitamins, so it's best taken with food to help your body absorb it. And a nice way to take B5 is with other vitamins to get the synergistic effect of them. I hope this has given you some good information about B5 and really the centrality of B5 and how your body's metabolism works. It's really quite amazing. I hope this has served you. May you be well.